Thank you for being here this evening. And for those of you who've joined us online, we apologize for the delay. There were terrible thunderstorms and storm warnings for Geneva. We were, in fact, afraid that we might even have to cancel it because the warnings were 100 kilometers per hour and whatnot, winds. But anyhow, it has calmed down a bit. Thank you all for coming in, those who are here physically, and thank you all for logging in, those who are joining us virtually. So it gives me great pleasure to welcome you all to the fourth lecture in the Dharma Alliance SDGs and Dharma Tradition series. We are very pleased to have a couple of wonderful speakers here this evening. And this all, in some ways, it's interesting because this takes off from where the last month's lecture left off, in the sense that we had Dr. Singh, transplant surgeon from Manchester, who spoke and who one of the elements which he spoke about in his lecture was how most Dharma traditions are not anti-science, how they work very closely with science, and there is no contradiction between Dharma traditions and scientific work and progress in research. And today we'll take on from there. But prior to the lecture, I first wanted to sort of, apart from the guests here, I want to especially welcome Bhante Dhammika, who's here, who's the head of the Centre International Buddhist de Genève, and also Dr. Mark Van Umeren, who will be introducing the subject, who is the head of the mental health unit at the WHO headquarters here in Geneva. So special welcomes to both of you, and we will definitely look forward to a very engaging session. I also wanted to point out that this series is we are being partnering with SLX Swiss Learning, which is an organization which works on developing knowledge products around sustainable development goals. And that's sort of the brief introduction. I will introduce briefly, if I can get my, about Professor Fjorback, Lone Fjorback, who's come in from Aarhus University in Denmark. She has been working as the director for the Danish Center for Mindfulness, which is at the Department of Clinical Medicine at the Aarhus University. And what we are very pleased about is that for the last decade or so, they've been carrying out wonderful work and developing a whole scientific base, a whole evidence base for how mindfulness techniques and processes and trainings can actually impact the public health system, can impact various mental health issues. And we're very pleased that she's going to be here with us. But I wouldn't like to take more time off from her, which is the main thing. But first, I'd like to invite Dr. Van Umeren to come and please introduce the subject, particularly from the WHO perspective. WHO has also been doing some work on mindfulness, and we'd love to hear more from him about what's the kind of work they've been doing and how this has been, and the direction in which he thinks these things are going. Thank you.
Thank you very much for inviting me, for organizing this. I'm very impressed that you managed to organize this next to a job. Very impressive. And I will try to speak not too long because I want to hear what Professor Fjorback is going to say. It's more interesting for me than hearing my own voice. So just a few thoughts. What does WHO look at? How does it look at mindfulness? We have recommendations where we, for example, recommend mindfulness for stress management. There is within the psychotherapies, there's a whole technical area of names of different therapies, and there's a group of therapies called third wave therapies, which are therapies that many of these therapies have elements of mindfulness. Some of them they're even called mindfulness CBT, and a number of other ones. And WHO is updating its recommendations for depression, and will be recommending third wave therapies for depression. We ourselves doing some work on, about 10 years ago, started looking at what we could do in this area. And we had a number of interviews with a number of experts. And we decided to go within the whole third wave therapy world to go with to go deeper and work deeper with the treatment called acceptance and commitment therapy, which has again many mindfulness elements. And that's a therapy that has it's not as contemplative as the many of the mindfulness approaches where there is the practice of having every day a number of maybe 30 minutes or an hour or 2 hours, depends on your practice. But in the acceptance and commitment therapy, that is much less, but very much focus on mindfulness in daily living. We've done randomized controlled trials on that, and showing that it prevents onset of mental disorders on refugees and Syrian refugees in Turkey. We have worked on trials in Sudan, in South Sudan, with in northern Uganda with Southern Sudanese refugees, etc. So that's an area. In terms of the science underneath, it's always amazing to me how psychologists who study for years the underlying elements of what they think is what leads to healthy behavior and unhealthy behavior, and then in the end, after all these years of research, come out with suggestions which look like exactly from a book of meditation that one buys in a bookstore. I lived in Nepal for 3.5 years, incidentally, and in that time, I would, very young, I was 25. I would go to the bookstore and read some books or go to a practice. And I was also a psychologist. I didn't see the two coming together. It was 25 years ago. But it was so similar. It was amazing. Then, of course, I'm sure the professor will talk more about that. A lot of science has been done over the last years, maybe also 25 years. And showing that many of these techniques, even whether they come from whatever history they come from, whether they come from a cultural religious background of the East, or whether they come from the scientists who say, oh, these are the same techniques. They when they test it and do strong randomized controlled trials, they prove effective. They work for reducing stress, and they have some good and anxiety and some other health outcomes, which I'm sure you will cover. The effects are not always huge, so I don't think this is like, now we have solved all the mental health crisis fixed if everybody just practices. I think the challenges are bigger, but the effects are important. So that's really. Maybe the last thing I want to say, because I don't want to take too much time, is that I think I was reading on Vipassana a number of years ago, Vipassana treatment. And from a historical perspective, I just done a 10-day Dhamma retreat, so after, so it was really interesting reading. And I learned from the readings, I don't know if it's true or not, but the writer described the blossoming of Vipassana coming out of Myanmar in the last century, and described it very much as an anti-colonial movement, where when the British colonized Myanmar, that at that time Vipassana was only done by monks and not but part of the movement against the colonials was actually a strengthening of the population of their cultural traditions. They wanted to as a form of resistance, and within that also the opening up of and the encouragement of these practices happened to the general, more to lay people. And I have no doubt that these practices sometimes change a little bit over time. I'm not sure they've always been the same all the time, but I think it's fascinating to see how these very important practices now are practiced all over the world, and that they are, and rather than normally there's a tension between what people practice want to do and what the science says, and you're going to, but actually there's such a convergence, such a conflation, and I think that's what makes it so popular. When somebody is interested in mindfulness and they talk to a scientist, and yes, it's scientifically proven, and there's scientists who actually got convinced and started doing meditation myself from a neuroscientist. So this is how there is conversion, which really accelerates the dissemination of these practices, and they're evidence-based. Thank you. Forward to your talk.
Thank you. I feel really honored to be here and to talk about this. Is my passion and my work, so it's a great pleasure. And just the wording: protect, preserve, promote Dhamma. and sustain life. I think that's what we are all figuring about or thinking about these days, or we should be thinking about. And I don't know if you know this picture. This is the since we started measuring the temperature, and now we are in the red zone. So change are happening, and I want to make the argument that the climate crisis and the mental health crisis are connected. It's about relationships, and what's in the outer world is a reflection of what's going on the inner side, and we all need to come together and make some changes. I come from this is my Dharma roots. I come from a yoga and meditation background. Before I started med school, I started a meditation school, and I went to a 3-month retreat, and I connected with the body, the mind, the nature, and I wondered if I should only focus on meditation or medicine, and then I chose both. And for a while, I lived 4 years in the yoga school, where I taught and also studied yoga meditation and meditation. And then I'm a psychiatrist, and I wanted to do research in use of yoga in research, and then and he started research. When he wrote book, he actually extended it to Japan, and he didn't want to use the word Dharma because it was and then Thich Nhat Hanh, he wrote back and said this is Dharma, so it's actually and then I think about you might have experienced those two people about the Okay, it's sounds different now. And Zen is all about starting once again and being curious and open to every moment. And then we've done some research also in compassion. And Nanya is a PhD student, and Jimpa, he's the main translator from His Holiness the Dalai Lama. And we have done research in compassion, and it's building on Santideva work on how to work with compassion in everyday life. So some years ago, we did a conference at Aarhus University to bridge the new science, and also where is the science going now in mindfulness. So there's the first wave of mindfulness research is that we have a cure for stress, actually. And this can also be used for in illness, for anxiety, depression, for chronic conditions. And then now, if we are not stressed and if we are not depressed, then we can use this for a wider perspective. So the first wave for mindfulness research is that we can use it for stress management and for to improve mental health. And then the second wave is that you can use this for illness. And then the third wave is how can we use this for more for working with climate, for social justice, for climate justice. So this is the field now. And then we made a conference and we call it Diversity and Equality, Leaving No One Behind. And first we call it Diversity and Oneness for the Sake of All Beings. And then at that time, it was forbidden to use these words. It was too much spiritual in the university or too religious. But now, since the pandemic, I think we know that if one person in China are sick, then it can be a problem for all of us, or it is a problem for all of us. And so the oneness perspective, it has changed how we perceive the world just within the last few years. This is Aarhus University, and this conference was online. And when I started the conference, I wanted to make some connection, and I would try to do the same here. That when you greet another person, you can say, "I am because you are." Or we can say, "The soul in me recognize the soul in you." Namaskar. Or "You today, me tomorrow." Or "You are perfect and please improve." So this is like a Zen koan that there's something that's really totally right, and then there's something that can be so much better. And that's also within the world and within all places. When I did my first training in yoga and meditation, I actually, there was researchers coming and checking our brain and hearts and everything, and they found out that the yoga lifestyle was good for everything. It was fantastic. This yoga teacher thought it was like a little he didn't like that they used the yoga lifestyle. But if you eat a strictly yoga diet, and if you live in a certain way, then so many things are different than from the rest of the world. But this lifestyle was good. But he wanted to like show that it's the yoga that's the active ingredients. And his perspective on what are you learning on a yoga school. I have a quote here. In the yoga teacher training, one learns to awaken and train consciousness, to stay aware, devote oneself to the present moment without demanding firstly that the conditions have to be different. Develop a knowledge of body, mind, and energy, take responsibility, and to be consistent in carrying out a task, whether big or small. And I think this is a skill that should be like a human right to know how you can do that, because this is a practical tool for how to be in the world. And the Center for Mindfulness at UMass was started by John Kabat-Zinn, and for a number of years directed by Saki Santorelli. The root of the Center of Mindfulness is planted in the soil of spirituality. And they have avoided using the word spirituality at that time, but by spirituality, I mean those qualities of mind and heart and human spirit that bring ease and contentment to both self and others, and from which we act for the benefit of others. In our experience, ongoing attention to this fundamental ground provides us a pathway for learning to embody ethical action, compassion, wisdom in the world. My root is also Danish, and this is a Danish author, and she's dead now, and people say that she should have won the Nobel Prize. I don't know if you can do that if you're dead, but she says that what we don't talk about. There are very few things worth talking about, and we don't talk about them. We can't talk about them. For instance, life, death, and love. We give them big and expensive names, something like a dress so good that we are not comfortable wearing it. We are shy, we are afraid, so we don't mention it. That kind of word is left hanging in the closet while we use the nice, ordinary, and undeniable practical words in our daily dealings with each other. We are afraid, but we manage. We are afraid to be alone and afraid to be with others, afraid for what's finished and at standstill, too orderly, and afraid of what's unfinished, messy, and disorderly. And we are afraid of sex, afraid of death, but we manage. Or do we? Could it be that the reason we are still having wars is that we are afraid to tell each other that we are afraid of each other and for everything else? To me, it's as if we keep going out in the rain and keep refusing to invent raincoats. And for me, yoga and meditation, mindfulness and compassion is like a raincoat. In our nervous system and also everywhere else, we can hold and control, and we can share and care. And when we hold and control, we are stressed out and we feel bad. And when we share and care, we feel good. But most of the time, we are like in this surviving mood. And so we hold and control, and we are afraid. And yoga, meditation, mindfulness, and compassion can be this movement to a more sharing and caring way of living. This is short is white dominant culture norms. That's like, this is a way of thinking that people just think that this is how it is. Like we have a sense of urgency that I need to hold and control because this is just this time. And then next year, oh, I need to hold and control because I just need to survive, so I can't let go. And so these are norms that's just, we don't think about them any longer. But it's just like overworking competition. These are just the way most people are. And with depression, now tops list, of course, of ill health, more than 700,000 people die due to suicide every year. Then we really need to protect, preserve, promote mental health. And what is mental health? Mental health is a state of well-being in which you can realize your potential, where you can deal with the normal stresses of life and where you can make a contribution. And we feel happy when we can use our talents, when we can deal with stress, and when we can give. And so the question is, how do we master thinking? How do we cultivate well-being? How do we manage stress, anxiety, depression, and pain? How to live a sustainable life and benefit all beings? And a junior is a hero in the Hindu tradition. And he got a panic attack because he wanted to do the right thing. And he saw, if I go to this way, then it's not all good. And if I go to this way, it's not all good. So I don't know what to do. And I think it's the same situation most of us feel like. That we want to do the good things, but it's like chaos. And then he was lucky that Krishna came and helped him. And he said, oh, you are so self-absorbed. You're thinking too much. You just need to do what you have to do. And you need to learn to open your heart and to give, and to give what is your talent. And this is a picture from Aarhus University that's really beautiful. And there's a story from Buddha also, that he wanted to find a cure for suffering also, and he found a cure for suffering. He said he found out how wonderful I'm alive. And not only I'm alive, everything is alive. We are alive. And in this field we can meet. And we try to build community within in local communities. So we have this is the town hall for Aarhus, and we invited people in for meditation, for free meditation, and 70 people just joined the first night, and it's 5 years ago, and since then, for once a week for 1 hour, we have been sitting down and practice meditation for everybody who just want to join. And this could also be a movement, but if we could stop our weapons and stop holding and control for just 1 hour, then and sit down, maybe that could be a pause for all of us. There's now I'm moving into research. So the Nature Human Behavior scientific paper measured all the different interventions to promote mental health, like acceptance and commitment therapy, CBT, cognitive behavioral therapy, different kind of interventions. And then, yeah, blessing. And then mindfulness came out as the strongest intervention. And then the two strongest mindfulness programs are mindfulness-based stress reduction, and that can promote mental health and reduce symptoms of stress, anxiety, depression, and pain. And there's mindfulness-based cognitive therapy, and it can be used as prevention and also for treatment for depression. And these are review and meta-analysis. So what is mindfulness? John Kabat-Zinn, he defined mindfulness as, it may be defined as the awareness arising through paying attention on purpose in the present moment, non-judgmentally, in the service of self-understanding, wisdom, and compassion. And the function of mindfulness is compassion. So what is compassion? And this is defined in scientific terms as to recognize suffering, to understand the universality of suffering, feeling for the person who is suffering, and to tolerate the uncomfortable feeling of suffering for another person, and also to be motivated and to act in order to alleviate this suffering. And then to alleviate suffering, that is ethics. And in Buddha ethics, there's 3 pure precepts: not knowing, thereby giving up fixed ideas about myself and the universe, I vow to cease from evil. Being witness to the joy and suffering of the world, I vow to practice good. Healing myself and others, I vow to save all beings. And in short, it is do no harm, be helpful, train the mind. And Anshu, who is here today, also just has been part of this book publication. It's called Arts and Mindfulness Education for Human Flourishing. And we talk about ethics and also how to giving up fixed ideas in the mind in order to both feel good and to understand the oneness of life, and also to train the mind. And these are the rules also, like the golden rule in most religions, but in the Hindi and Buddhist tradition, then there's this focus on training the mind. And when you train the mind, then in meditation, there's mindfulness meditation and there's compassion meditation, and they're different kind of meditations. And then there are different manualized 8-week group programs. And for the mindfulness interventions, there's 100 randomized controlled trials, and the compassion interventions, there's about 10 randomized controlled trials. Hi. So, welcome. There are 3 waves, as I mentioned. First, using the wisdom of your body and mind to face stress. Then there's a mindful wave through depression, and then we can make a contribution. And the contribution we have been working on for the past 10 years is investigate how to promote mental health across a lifespan in clinical and non-clinical population. We have conducted a number of effectiveness randomized controlled trials which has confirmed that manualized mental health interventions based on training the mind in mindfulness and compassion in real-life contexts are feasible and have the potential to promote mental health across the lifespan in clinical and non-clinical population. And we have worked with pregnant women with special needs, pregnant women with stress, anxiety, depression, violence, difficult social situations. And we have conducted a program for these pregnant women, and we have a randomized control trial, first a pilot randomized control trial, and now the main trial is ongoing work, but they benefit, they are highly motivated. This is maybe the time in one's life where people are most motivated, and they want to make a contribution and also to make a change. So it's wonderful to work with them, and they feel they have they belong in a group which is really beautiful, and then they get tools to feel calm and to reduce stress, and also to connect better with the children. And then we have done work in schools, and this is ongoing work, but the fact is, which we have some publication also, that in the beginning of school, then the boys, they sometimes have some difficulties. At the end of school, they don't have that any longer. But with the girls, they don't have any difficulties when they start, but when they leave school, they have difficulties. And then we have worked with the youth and students, and when we offer mindfulness-based stress reduction at the university or for students, then many of the students, they have really poor mental health. And in 8 weeks, then they come out and they are flourishing. They feel they belong in a group. They feel they have the tools so they can better study and better engage in the social life. They feel less loneliness. And for healthy adults, we have done this as prevention. And we've also found good results. And in older adults, and then we've worked with caregivers. If you are a caregiver to a person who has a mental disorder, this is really suffering. And we've done a big randomized controlled trial also showing good results. And then for people who are sick leave with stress, we can use the mindfulness-based stress reduction as treatment, and it's better. We have better outcome than local developed mindfulness programs. And then we have done research in depression. And for it's not a new thing that MBCT is working for depression, but it's new to understand how this is working. So we have put people with 3 depression episode into a brain scanner, and then we have seen how they deal with the rumination. So we ask them to ruminate while they're in the scanner, and also we ask them to meditate. And then those who went in, this is a randomized controlled trial, those patients who learned mindfulness-based cognitive therapy, they learned how to stop ruminating. So they learn to come out of their head and to relax in the body, and we can see that in on the brain scanners. And then this is training in compassion. So this is if you are a caregiver for a patient with a mental illness, then you would like to alleviate the suffering for this person, and we show that this was actually possible. And for this is a big randomized controlled trial with a compassion with 140 patient caregivers and 6-month follow-up. And we also looked into the mechanism. So why is this working? But what makes people when they start a program and have poor mental health? What is it that is working that when they are finished with the program and they have good mental health? And we found that the 2 things that needs to be elevated, and the one thing is mindfulness and the other thing is compassion. So these are the tools that you need if you want to reduce stress and if you want to enhance well-being and to deal with depression. And just today we came out with another paper also on mechanism that it is actually possible to train your mind, and we don't need to put everybody into a brain scanner. We have other tools that we can measure. And we do that with just asking people to sit for 3 minutes doing nothing, and then they write afterwards what they are thinking about, and then we can use this and also measure how they are thinking. And most people, they think in the same way, even 10 years after they're ruminating about the same thing. Oh, I'm not good enough, or I can't control this, or and then. But if they learn mindfulness and compassion, then they can actually change the way they are thinking and learn not to ruminate, but instead to relax in the body. And then we've seen on mindfulness in organization, in the workplace, there's a lot of pressure also. And this is a PhD student. She's finished in a few months, but she already published 3 papers. And what we did was that we offered in private organizations, we offered mindfulness, and we said everybody in the organization, they have to learn on mental health. What is mental health? How can it be improved? And then those who choose, they could enter a course. And in all 4 companies, almost everyone, they attended the workshop, and half wanted to practice mindfulness. And those who entered the mindfulness course, 80% actually finished the course. And then we could see that the working environment in the whole organization improved, that it was easier to collaborate, and the working environment was better. So this is just a recap of some of the research. And also we have done in EU program for educators where they learn to deal with stress and also to work with social, emotional, and diversity awareness. So we have a mind, a heart, and a body, and we can use yoga, meditation, compassion, and mindfulness to train. And this is my thought on what this is. I believe it is a path to freedom. And mindfulness is consciousness. Compassion means to embrace the suffering of others. To embrace the suffering of others is to be liberated. Mindfulness plus compassion is wisdom, and wisdom is understanding. To understand is to learn. To practice wisdom is to practice generosity. When we give, we do good and we feel good. When we hold and control, we are no longer free. And when we are no longer free, we are ruminating about it. And we can stop this. And there's different networks in the brain. One is the salience network that receives all the sensory input of the body. And then we have another network we use when we carry out a task. And then we have a reflection network, or the default mode network. And this is the default is our ability to reflect. And it's so wonderful that we can reflect. But if we are not trained in how to reflect and how to use the default mode network, then it can be just ruminating. And then we don't like this sad story. So we are busy all the time because we have this sad story. And the trick is that you can learn to relax in the body, and you can learn to reflect in an open way, and then your thinking will be better, and also your ability to carrying out a task will be better. And from a neuroscience perspective, it is impossible to think deep, reflect, and create a memory without emotional engagement. So it's not good for us if we're not connected to the body, because we can't actually learn. So what can we learn from meditation? We can learn, and also this is also from a neuroscience perspective, we can learn to be present, we can learn to feel connected, to get curious, and to stay motivated. So what we are working on now is how to have this social engagement connected with meditation. And the first thing we did was that we established a climate club where we studied Thich Nhat Hanh Zen and the art of saving the planet. And then we were, like most people, we think climate is good, but I'm too busy, or I don't know what I'm doing the same as usual or whatever. And then so we studied this one, and then some people they thought it was they became enlightened and thought it was wonderful, and many people they thought this is too philosophical. And then we made a new climate club, and then we studied Greta Thunberg's The Climate Book, and then we had NGOs talking for half an hour on climate actions and climate things, and then we meditated for half an hour, and then we had dialogue for half an hour. And then climate, it is a bit like stress and depression and mental health. It can be like a cloud. Oh, I don't go there. It's too, I just become depressed. So it's actually difficult to just look in the suffering of how we are behaving and how we are acting and how we are living. And people up to 30 years of age, they are active and they want to do something. And then people from 70 and above, they want to contribute. But the middle group, that's the problem. They are all busy. And there's a Safe Soil movement. There's a Vedanta Shiva movement also on how we connect to nature. And this is related to how we connect to our mental health. So mindfulness and compassion can be used for social and climate justice. And in the Collective Mind book, then we can use literature for human growth, can look at the neuroscience of ethics, and we can look at human rights and ethics as a spiritual practice. So I think that this is where this field is moving now. And thank you all.
Professor Fjorback. We have a few minutes for some questions. Anybody?
Hello. I know you come from a country which is rated as one of the most happy countries in the world. And I'm also very glad that you are talking about the mindfulness. I have a very naive question. When you talk about mindfulness and when you say that you have to train your brain and so on, and if you are looking at the human anatomy, where will you place the mind?
I will place it in the heart, definitely. And I will, but I think we need also the attention to go there.
But where do you find the mind?
Yeah.
Look at your body. I mean, your brain, you know that. Your hands, you know. But when you talk about mind, what is it?
Yeah. This is a Zen koan also. There is a mind and there is no mind. There is the big mind, and there's a stream of memory, and then there's the mind that can be what can you actually do? Where can you place your attention? Where can you that there is something that you can do, and maybe the tool is that you learn how to undo because you're so busy doing things. And if you just leave the mind, then
Thank you very much for this very interesting and I think stimulating presentation about the mindfulness and its benefic effects. I have 2 or 3 questions. First, I think it's a very simple, but I was not clear whether you use mindfulness and meditation in a synonymous way, or is there any difference between the two? The second one is about when you give a mindfulness-based training, is it given to a group, collectively to a group, or to individuals, or is it individualized? Because I can imagine that if 2 people can be stressed, but they may be able to, their abilities to cope or not, inability to cope could be different from one individual to the other. So is there a necessity to go into that kind of a very specificities, or is it addressed to a group? That would be my second question. And this third would be about the randomized control trials. Do you also, again, similar to the second one, do you also control for the other characteristics when you put the control group versus the treatment group? The people who go to who take the training versus the people who don't take, Are they similar in their characteristics, and what kind of characteristics are you looking for? Again, it's because in terms of, concrete things like whether they what income or socioeconomic group, and it's easy to find. But when you're dealing with mental health, what are the other characteristics that you need to control for when you separate them into control and treatment groups?
The first thing, meditation is a practice, and then mindfulness is also a practice, and mindfulness is also an outcome. So it's something, there's so many definitions of mindfulness, and it can also be like mindfulness as consciousness, as the brief thing, and then compassion is love. And the function of being in this consciousness is that you are able to give. And meditation is more like a tool you use, and mindfulness is what you can, is for every minute of your life. So it's not just a period where you meditate. And then there's, yeah, it is we do groups. We have done all the randomized controlled trials are groups, and we control for whatever is possible to control for, and then we have big randomized controlled trials. So so we hope that it's distributed, and we measure this also in the when we publish the papers. So, and we do the research in real life setting. So the research we have done with students is students within a university, and then they can sign up for mindfulness, and then they are randomized, and then we check that they are similar, the two groups. Or in a real life work setting, or in for depression, for people who are in a clinic with depression. So those are the patients we deal with. Sometimes in the effectiveness study, as we have done, is studies in real life settings. Other studies, they do efficacy studies where they have a special group or a few group to see if this is working. So this is the beginning of studies, but the effectiveness is more like this is more easy to implement in real life afterwards. Yeah.
Thank you so much. It was really interesting and good presentation. I have a question. I mean, I believe in the effect of mindfulness and meditation, and as well as yoga. During the time I was on break from work, I started to meditate, and it was just a blissful experience, because you really do not, for me, it was more like everything is within me. All the problems that I'm prescribing to the world is actually within me, and my understanding of things and how my mind ruminates to persuade me, to give me all the arguments that are actually nonsense. So that was really amazing, the realization, and that gave me this joy and happiness that probably Buddha was referring to. The problem now, back to work, is that it's too much of work and stress and responsibilities, so that somehow it's, the moment I close my eyes, I started thinking, oh, I have to do this, I have to go and do this, I have to go do this. And then I was, how do I go back to that state, or to this moment when I was succeeding to meditate? And then I was looking for the tools, like there are now, have you ever tested of these tools, like you can put on your head and it measure your brain waves, and when your mind starts going to remunerate, the music activates and it puts you back to the present moment. do you have any kind of?
I tried it also out long times ago, but I'm more into slow growth, and then it's you who know when you are tensed and when you ruminate, instead of building it up into a machine. But this is in the compassion training. The last class is called How to Live at Ease in a Crazy World. So there are meditations from some meditations called the Lojong teachings, where you can use slogans in your everyday life in how to not get ruminated. That's one kind. That there are tools to work with how to meditate all the time, and how to use this also when in a busy work environment. But then at the same time, it's not possible to, maybe it's not possible to work at the pace that we are working. Maybe it's not sustainable to be overworking like so many of us are doing. And then maybe we, when we're working, we are holding and controlling, and we work more and more and more, and we can't meditate because then this. So
it is
it needs to be a balance,
or it is a problem of not persisting every morning to give yourself a minute of not doing anything else but thinking. I mean, what are the tools?
You should own all your minutes.
Because I think in my in my environment, almost all people are aware of how meditation and mindfulness is helpful, but nobody succeeds to have a how to say
stable practice,
to persist
yeah,
over time and to start really enjoying it. Because most of us come to that time 1, 2, 3 times, and then we don't follow through it. So we kind of don't overlap that part when the brain starts distracting us. So because that they said that, okay, we should do it every morning 1 minute, and then you increase 2 minutes, and then 3 minutes. So don't have too big expectations, just to have 1 minute of not thinking of anything. But then I don't do it. And many people are struggling. Why don't I do it? Anyway, so.
If I might just add, how do you best teach out in your programs compassion? Clearly, the world needs more compassion. And as an anecdote, our child was in a play where through drama, putting himself in the shoes of a refugee and playing out how it actually feels to be. And so now that for us was an example, but we also work in an area of human rights. We think that human rights education, peace education, that can be the kind of help to change mindsets and be more embracing, welcoming of diversity and so on. But in your experience, how do you best impart knowledge about or practice compassion as one component, as you said, mindfulness and compassion? That's one question. The second question, just if I may, you did refer to how boys and girls and a distinction. I'm not sure I got if you said that boys sometimes go into the program with anxiety and they come out with a better. Girls might not, but they come out with anxiety. I think I misunderstood, but if you mind just clarifying, it would be interesting to hear if there's a dimension there that is distinct, or as you saw. Thank you.
In 20 years ago, mindfulness was popular. Then people didn't want to meditate. Then then it was not so popular. And then now compassion is popular. But you cannot practice compassion if you don't know your consciousness. If you don't have mindfulness connection, then it's impossible. If you cannot deal with other people's suffering if you don't know how to deal with your own. That's really difficult. But now compassion is really popular. Because I think people just want new things also. And then the compassion is sort of new. And then we have actually, when people come into the program and they don't have a practice and they want to just fix the other people's problem, then we have to build in more mindfulness and more. We have to teach people how to stabilize their body, how to stabilize their mind, and then they can move into compassion slowly. And then many people, they when they enter the compassion, then they understand that they need to learn more mindfulness. But in the mindfulness training, then the main focus is on the body, to place your consciousness in the body, or your awareness in the body. And in compassion training, then you can work with loving kindness for a long time. So if you really want to feel good for yourself, you want, like, it come back to your question also, why don't I practice? If you can practice compassion and you want to, I want to be like, if you think about a small baby, you want the best thing for this small baby. You want this baby to be protected, to be happy, to be healthy, to live at ease. And then you can feel the same thing. Can I feel this for myself? Can I feel that I want to be protected, that I will be happy, that I will be healthy, that I will work at ease? And if I can feel this, and then you start to working with this, then this can actually keep you thinking, but should I be eating this? Should I be talking to this person at this moment? Should I engage in this program or in this task or whatever? Yeah, and what I with the boys and girls that's in ordinary schools in Denmark, then when in the beginning of school, when the kids are small, then sometimes the boys, they have some difficulties with attention and other difficulties. The girls are fine, but when they leave school, the girls, their mental health is no longer just fine. Now in many places from 16 to 24, that's the burden of young people is like 50% of women, they feel stressed out, and a third of the boys do. And this can be changed. It's not that bad being either a boy or a girl or whatever in between.
Thank you very much. Very beautiful presentation that you have done today. Stimulating and really rich. The word mindfulness is really, you all know, it's come from very, very old tradition. You know, Buddha, he spoke about that. In Greek, the Plato, Aristotle, they talk about that. And in Iran, Zoroastra, he talks about that. In China, Lao Tse and Confucius, they all talk about that. It's come from very, very old tradition. As a Buddhist monk, I have to tell you, there are 84,000 teachings of the Buddha, mostly based on the word mindfulness. His word is sati, mindfulness, of course. Okay, so we are here very happy that you are showing us different directions how we can use the mindfulness to the human benefits, to get obtaining human benefits or for the human. And somebody asked about the mind. Where is the mind? Normally, many people think the mind is related with the heart or brain.
Mm-hmm.
In briefly, I can tell for him and for you all, where there is a blood, there is a mind. Okay, where there is a blood, there is a mind. Anyway, okay. And she asked something very also interesting: meditation and the mindfulness. Meditation is the tool to obtaining or developing mindfulness. Even the teachings of the Buddha, maybe Hinduism also. Okay, and it's very nice to hear all your beautiful presentation. Thank you very much, and we appreciate a lot. Okay, thank you.
Thank you. And I think we need to look deeper into what is research also, because this is research by so many people. like your tradition, many other traditions, and how can we bring more voices into research? I think that's an inquiry we should look into.
I would like to say something about the new research we can do today, biological. Rick Hansen has done a lot already. We can prove today we have something new. We can prove in the brain what is happening with the amygdala and so on. This is what we can do new today.
I just wanted to follow up on the question of compassion. How does compassion relate to emotion? Because many times when we see others suffering, your reaction is based on your own emotion. And then you can divide it into sympathy and empathy, whatever. When you talk about compassion, where does it fit in? Is it sympathy, simply feeling for them, or empathy?
It's both, and it's more. It's both that you have the awareness, so you see the suffering, and then you feel the empathy. You feel the suffering, and then you have sympathy for the person who is suffering, and then you're motivated to actually helping. So it's all of these things. And then the emotion part, then when we have a body and when we sense, then we are proud, this is me. And then I want this and I don't want this. And then we have some mental reaction. And then we think, how can I get this? And how can I avoid this? And then we have a consciousness. And then we can notice this. And this consciousness can be filled with aggression. But the same consciousness can be used to cultivate emotions like mindfulness and compassion. So this is when I use my mind in this way, it brings these kinds of results. If I use it in this other way, then it would have these results.
Dr. Fjorback, thank you very much. It was a wonderful presentation. I'm pleased to see that we have a great turnout. I'm so happy to notice that the room has actually got a great turnout. The rain didn't scare anybody off, so that's a good sign that they were interested in the subject matter tonight. Also, I want to say thank you also to Dr. Van Orman. Thank you for your very nice and generous introduction at the beginning. Just a few programming notes. Obviously, the summer's coming up, and everyone's going to have a great time in the summer, and we will not hold any events during the summer, so take advantage to think about what Dr. Fjorback talked about tonight. Hopefully, you'll have some moments to enjoy and reflect on that kind of material. And in terms of future events in the autumn, just please check back with the website, or we'll if you see, inform you via our typical links. Okay. And for those who are present tonight, please stay and enjoy the apéro that we've set up for you outside to continue the conversation. And on that note, thank you for those of you who've joined us online, and we'll see you soon. Okay. Good night and have a great vacation.